Dr. Chase, you have a few moments?
Sorry, I've got to go.
You're Chase's dad.
Whoa, hold on, guys. I don't care that you're up here.
A few episodes ago, we made House's dating profile. What would Chase's be? Very excited to be reacting to House MD Season 1, Episode 13, Cursed. On this channel, we are reacting to all 177 House episodes, and this would be Episode 37. Let's see if I can get the diagnosis before House does, as a doctor working in London.
I'm not thirsty. Oh, dark spirit. Will any of us die in the year to come?
Kate.
You've had a fever for almost a week now.
Don't mess with dark magic. What they're using there is called a Ouija board. Came out of a 19th century America fascinated with spiritualism. Interestingly, the advertisers of the board actually said it was proven to answer all questions of future and past at the patents office before its license could be granted. Sounds like ChatGPT. The American people at the time believed that the board was a way for the dead to communicate with the living. It gave a type of comfort to people in a difficult time, as the average life expectancy was less than 50. Women were dying during childbirth, children from disease, men from war. Seance parties to contact the afterlife were all the rave to help comfort those at home whose loved ones went away to war and never returned. Now, this historic board has told our poor protagonist that he's about to kick the bucket, and he believes it. 1 week of fever, we would be worried about sepsis, tonsillitis, Kawasaki's disease, need some blood tests to look in his throat, his ears, and if all clear, contact the local exorcist.
Purulent sputum, dyspnea, bronchi bilaterally. What kind of pneumonia causes this kind of rash?
Rickettsia, tick bite.
New Jersey, it's most likely Lyme disease.
So we've got a papular rash and atypical pneumonia in a 12-year-old boy. What could this be? Metabolic could be type 1 diabetes, hypothyroidism. Infectious could be Legionnaires, mycoplasma, PCP, TB. The team also suggested chlamydia pneumonia. Could also be parasitic with Ascaris, schistosoma, and toxoplasmosis. Neoplastic could be things like leukemia or lymphoma. Inflammatory could be Wagner's or lupus. It's never lupus, I know. Could be lupus. Toxins could be heavy metal poisoning. I would definitely keep him on fluids and cefuroxime. The history will be very important here. Any recent travel, any pets, swimming in freshwater lakes, you know the drill.
We need to know if you're sexually active.
Nothing like that. I'm cursed. I have the worst luck. I broke this mirror. The next week, my parents got separated.
This poor boy believes he's unlucky. Very interesting. Now, Professor Richard Wiseman has spent his life studying luck and has come to some interesting conclusions. Believing you're unlucky can actually make it so. Ergo, believing you're lucky can make you more successful. He has even proven it using an experiment with a self-proclaimed lucky and unlucky person put into the same environment, a coffee shop queue, tasked to buy a coffee once they get to the till. The unlucky person goes through the queue, buys a coffee, sits down and drinks it. The lucky person gets in the queue, remember same environment, starts talking to the person next to him, realizes that they are a very successful entrepreneur worth many millions, then looks down and sees a Benjamin Franklin $100 bill on the floor, gets the coffee, ends up chatting to the entrepreneur and making arrangements for meeting again and possibly doing business together. Wiseman speaks about much more in his book, The Luck Factor, which you can get for free with a trial of Audible in the US in the link down below if you're interested. By following that link, it is an affiliate link, so you will be supporting the channel even just by signing up to a free trial. So check it out down below. Either way, it seems like the father is quite an intense, high-powered guy who used to be an Air Force test pilot, according to the kid. Also, the kid hasn't been camping, so the tick theory goes out the window. Question for you smart people though. What percentage of people consider themselves lucky? Answers down below.
My parents split up too. Every kid feels like it's his fault. It never is. Maybe you were somewhere you weren't supposed to be.
A secret club.
He fell on something in the attic, scraped his arm, got the rush the next day.
Oh, so it started after being in that loft. Seemed like an abandoned building, could have had mold growing in the loft. So pneumocystis pneumonia goes up the list, although that only usually presents in immunosuppressed patients. Another thing is that he didn't get it from the attic at all, and he got the infection from his dad. There's been this focus on chlamydia. What if it's his father that got chlamydia while flying high and then transmitted it to his son by coughing or sneezing? I actually met a 24-year-old married female with chlamydia pneumonia once while I was working on respiratory, and she was so worried that her husband thought that she was cheating to contract it. I had to have a 45-minute consultation with both of them to explain that it's actually not sexually transmitted. So Chase asking a 12-year-old boy if he's sexually active in front of his parents probably isn't the smartest move. Now the best way to diagnose it is with a sputum sample or a blood test. So that would be my next move.
Dr. Chase, you have a few moments?
Sorry, I've got to go.
You're Chase's dad.
Whoa, hold on, guys. I don't care that you're up here.
A few episodes ago we made House's dating profile. What would Chase's be? 26-year-old full-time doctor, neurocardiac surgeon and intensivist, part-time ninja. The only thing I can do faster than breaking into your ex's house is save your dad. Swipe right to hear my Aussie accent. Good thing Tinder didn't exist in 2003. He'd crashed the thing. Now, if you're enjoying this video and want to support me improve the content, then check out the channel membership. Not only does it help me a lot, but it also gives you access to some exclusive perks, like being able to recommend a series and episode for me to react to, as well as early access to new videos. The first 30 members will be in with a chance to win a one-on-one tutor session with me on any medical topic of your choice. We're currently at 10 members with only 20 spots left, so make sure to secure one before they're gone. Also, the earlier you join, the earlier I'll be able to react to your suggestions. Press join now.
You fell on it. Some weird kind of insulation.
Not cotton, animal hair. Give him the CT scan.
We've got to get this kid on Levaquin.
Anthrax.
Maybe he is cursed.
Anthrax. Anthrax? Where's that exorcist I asked for? Anthrax actually has a very interesting history, as it's thought to originate from the times of Moses in ancient Egypt, being the 5th of the 10 plagues affecting horses, cattle, sheep, camels and oxen. In modern history it's known as the wool sorter's disease, as in the 19th century it was realized that the organism was transmitted through animal hair. The deadly disease was weaponized during the First World War, with rumors that Germany secretly infected cattle that they knew were going to be traded to the Allied nations. One batch of Argentinian livestock between 1917 and 1918 was infected, leading to the death of 200 mules. The 1925 Geneva Protocol then acted as a peace treaty to limit the use of biological weapons such as anthrax in warfare. Anthrax had been used after that, but only with limited casualties. Interestingly, in 2010 there was actually a breakout in the UK and Germany amongst heroin users. New symptoms occurred that didn't quite fit the usual cutaneous anthrax, where lesions are a raised sore with a black center. The heroin seemed to be contaminated with a new type of anthrax, and injecting it led to spores entering the body on a more deep level. Diagnosis is usually relatively simple, as you can see the bacteria on blood cultures. Treatment is with a specific antitoxin named anthrax immunoglobulin, or it can be treated with broad spectrum antibiotics like Cameron suggested. What a spicy case!
We've got to intubate. Add it back.
Hey, give me a smaller tube.
We're traking. I'm doing this.
Got it.
He's okay.
He's allergic to 2 antibiotics.
Oh, I actually thought that medical scene was done quite well, except Chase just randomly having a bronchoscope by the bed, and also how quickly the patient deteriorated. He managed to give sedation with lorazepam when he realized he needed to intubate, which was good. Also really highlighted the difficulty between deciding to do an emergency tracheostomy and continuing with endotracheal intubation. Recovery and complications are less with the conventional route, but continuing with that when you're not getting in can have disastrous consequences and has done in the past. There was a case of a lady named Elaine Bromley, a 37-year-old woman who went into surgery on the 29th of March 2005. Everything was going as normal and she was put under anesthetic with 200 milligrams of propofol. They then tried to get an airway for 10 minutes and her oxygen saturations dropped to 40% or below. During this event, the theatre assistant brought the tracheostomy set and said tracheostomy set available, but was ignored. The consultants trying to intubate had lost situational awareness. They kept trying even further, using advanced techniques for a further 10 minutes, then managed to get the airway. By that point, it was too late. She had severe hypoxic brain injury and passed away shortly after. If you can't intubate or ventilate, then doing a tracheostomy becomes an emergency urgent procedure that needs to be performed. Really tough situation. Lucky Foreman managed to get the endotracheal tube when he did.
I want to know what Dr. Chase thinks. The other Dr. Chase.
Is it possible you guys got this one wrong?
It's not anthrax.
Sarcoidosis.
Send an ACE level. If it comes back positive, put him on methotrexate.
What if the nodules are granulomas but not from sarcoidosis? What else in that loft could cause this patient's respiratory distress? Maybe rats, rat lungworm, or angiostrongylosis could cause the nodular appearance and airway narrowing. Treatment is supportive, including steroids, and there have been some cases where albendazole has been used to limit the inflammation and potentially surgical removal of the nodules, although it would be very tough in the trachea. The next thing we would expect is symptoms of meningitis if that were the case. But they put him on methotrexate like House is saying for sarcoidosis. That would really knock the child off if there's infection.
Necrosis.
Keep him on antibiotics for the anthrax and start the methotrexate for the sarcoidosis. See what happens.
I'm gonna biopsy his skin lesions.
Oh, new symptom. Exciting. The way that looks makes me think of a neurocutaneous syndrome. The nodules in his trachea also could be small tumorous growths rather than infections. Neurocutaneous syndromes include things like neurofibromatosis type 1, von Hippel-Lindau, ataxia telangiectasia, Sturge-Weber, and tuberous sclerosis. They cause multiple growths of the nerves in various places, and maybe he also has anthrax. Two conditions in one is very uncommon, but this is the Zebra channel. Maybe I should change my name to that.
Your diagnosis is wrong. No autoimmune disease. Why are you here?
I miss you.
I was 15 years old when you walked out. Now you're walking back in.
I left your mother. I didn't leave you.
Very interesting character development between Chase Jr. and Sr. here. Seems like his mother was an alcoholic and his father left, then sadly Chase's mother passed away. No wonder he could empathize with the patient when he was talking about the broken mirror causing his parents to separate. I love how House creates the reflection between the doctor's lives and the patient's life that show that doctors are dealing with their own stuff too, yet still go on. I do love that aspect of this show, humanizing us a little bit. Well done, Universal. Now it seems like Chase is on a mission to prove his rheumatologist father wrong.
You want a negative test for every autoimmune disease known to man? Fine. I'll get him.
A little blue dot under your collar. It's a tattoo for guiding radiation treatment.
Lungs, stage 4.
Damn! Chase's dad has metastatic lung cancer. That's why he's here to see Chase, to make peace. See, stage 4 lung cancer is very deadly with a 5-year survival rate of only 8% and only 20% live more than 6 months. Lung cancer claims the most lives annually of any cancer and is linked with cigarette smoking in 80 to 90% of lung cancer deaths. Some people say you could feel the Nile with the amount of blood on tobacco companies' hands. Other people say that the patients did it to themselves. I'll let you decide on that, but to show you the power of addiction, I'm going to tell you a case I saw. I was in the hospice and a 62-year-old woman was dying from smoking-related lung cancer in front of her daughter's eyes. The 31-year-old daughter had just become a new mom. She left the room and walked into the garden, lit a cigarette as her mother was drawing her last breaths from lung cancer next to her. How much control do we really have over things we know are bad for us?
I can't move my hand.
What kind of brain process would cause a paralyzed hand, skin lesions, and swollen throat nodules?
But multiple neurofibromatosis.
Get a CT scan. His brain this time.
Did Chase Sr. just agree with Chase Jr.? Oh, that must have felt good. If it is neurofibromatosis, I did say that, but mixed with other conditions, so I'm not sure if that counts. Let's see what the CT shows. Neurofibromatosis type 1 is caused by a mutation in the NF1 gene, which produces a protein named neurofibromin that regulates cell growth. The mutated gene leads to a loss of neurofibromin and subsequent uncontrolled cell growth without that regulator in place. These patients can have flat, light brown spots on the skin known as café au lait spots, growths on the iris, pea-sized lumps under the skin, learning disabilities or bone deformities as well. There's no direct treatment except for controlling the complications like surgery to cut out problematic tumors or chemoradiotherapy for any malignant transforming lesions, physiotherapy and pain medications as well.
It's not neurofibromatosis.
Tell the truth, or your son will die. How long were you in Asia?
2 years. This guru, I thought he had some answers.
Oh, good for the child, it's not neurofibromatosis. Early in the episode, the dad mentioned two very rare conditions, leishmaniasis and filariasis. It was discounted by the team as it didn't have any recent travel history to Asia, but Guru in 1987. In 2023, we just get scammed by gurus online. The conditions mentioned are parasites passed around by sandfly bites and are very deadly, but treatable with albendazole. Another potential diagnosis here, especially with nerve involvement and numbness, a rash, could be leprosy, but that would be a bit too spicy. Let's see if it's that. Who knows?
Leprosy?
It's leprosy. Run a fight sting. It'll be positive.
But the antibiotics we gave him, they cure leprosy.
The antibiotics hit the nerve strands.
Leprosy! Oh! I got that with the Guru reference, but it was pretty late. Incredible diagnosis. This episode is very carefully crafted. 8.5 out of 10 for entertainment, 7 out of 10 for accuracy, 9 out of 10 diagnosis. Pretty cool. Now it seems like the kid got it from his dad, who's in the chronic stages of infection with Mycobacterium leprae. With early diagnosis and treatment, however, it can be treated and cleared with a mix of dapsone, rifampicin and clofazimine. I love how the episode is called Cursed, as in the Bible, leprosy was seen as an act of divine retribution against evil thoughts and deeds. It was even called the finger of God. Infectious diseases consultants would agree, Mycobacteria the devil.
They kill the leprosy bacteria, and the corpses get tossed into the system. Produce antibodies that beat dead bacteria. Attack his neural and fat cells, causing inflammation and all the rest of his symptoms.
What House is talking about here is the autoimmune predilection with leprosy that was characterized as early as 1969 in the Bulletin of the World Health Organization. People with leprosy are generally split into two categories, lepromatous leprosy and tuberculous leprosy. In lepromatous leprosy, an autoimmune condition can ensue that resembles lupus or rheumatoid arthritis due to autoantibody and immune complex production. Very impressive for Universal to know this. We are in the niche areas of niche territory here. Clearly their medical consult has had some guru advice themselves.
Just send up some thalidomide.
Are you gonna have to tell my friends I'm a leper?
You had the antibiotics. You're not contagious anymore.
He's your dad. It doesn't matter what he does, you're gonna love him.
So beautiful. We can always learn things from what we tell our patients. Doctors are definitely not perfect, and sometimes we don't take our own advice. We have pizza parties and drink Coca-Cola, even eat at McDonald's. Ultimately, we're humans too, and we're learning throughout life how to manage just as our patients are. What's that old saying? Do as I say, not as I do. I will try my best to be an example though. But now it's my turn to diagnose you. Seems like you've got a house reaction deficiency. Oh look, the cure's popping up here. Go on, treat yourself. I'm Sarah Med, stay curious.